welcome to Health Talk. Thank you for joining us today. Today's topic is something really common. Why don't we take our medicines? Some of us don't take our medicines at all. Some of us don't take them on time. Some of us forget. But all of us have not taken our medicines correctly. So why don't we take them? This is an issue in medical lingo is called patient compliance or patient adherence. With us today we have Kevin Liu, Laura Billard, and Dr. Mary Rithu. Kevin worked a lot in nursing homes and he's dealt with the elderly. Why is it hard for elderly to take their medicine?
Well, there are so many possibilities. For example, I was working with this older gentleman. He was blind in one eye, and he's very forgetful. He reminds me of my own grandpa. And so, for me, I had to consistently remind him of his medications because he would forget to take his medications.
Also, it's very hard to see.
Exactly.
Like, for example, if you have Coca-Cola, this is gigantic, this is Coca-Cola. You know it's labeled, it's Coca-Cola. Then you have Diet Coke. Again, the diet's pretty big. Diet, Coke, it's a different label. People see that. Here we have tears, preservative-free tears. The most important thing here is preservative. It's white against blue-gray. If you have any vision problems, you can't see that. Preservative-free is considered better for most patients because they're allergic. So labeling is very important. So if you're elderly or any age and you have a vision problem, because you need this, you're precisely the group that's being targeted, and you can't see, and you're surrounded at CVS, Walmart, Kmart, whatever, and you have wall of these same-looking things, same-looking packaging, all of which you can't see, so it's a blur. So we think it's because the manufacturers want you to buy all of them because you can't see, so that means they make more money. No, just joking. But it is a problem. Whereas Diet Coke, diet is about a big part of it. They know it's diet. It's labeled differently. Whereas regular Coke, they have a logo, it's labeled. And if you're a person and you need to take a pill, here is tamper-proof, child-proof, and so you actually have to press here, turn. Now what if you have rheumatoid arthritis, you're missing fingers, you are a war veteran, you lost control of one hand, you have stroke, you're just weak, your fingers are knobby and all bent, you can't control this to turn this. Then you can't read this. This lettering is so small, they don't make it big print. You don't know what you're taking. So that's why many patients come to a doctor's office and say, I have a blue pill, I have a white pill. All the pills are white, especially with generics. They're no longer colored. It used to be branded. Sometimes they were triangular. But it would be interesting if all the hypertensives were all one size and one color. And all the blood thinners were one size, one color, like square pills, are all oval. But unfortunately, that's not the case. So the elderly, they get confused. And even if you're not so elderly, you get confused because you have to read it. I've had many people who are 20 years old tell me they've put eardrops into their eyes. That was not good. They're 22 years old. And so it's a bad problem. So, Dr. Rithu, what has been your experience?
Yes, absolutely. That's a huge concern. Every day we see about, like, if you have over 20 patients, at least 2 of them are not on the medications. And that can be of a lot of causes why they are not on the medications. One, it could be because of socioeconomic causes. One is that the insurances don't afford it, because nowadays we have the insurances taking care of our medications, and some of them don't cover the medications. So that could be one reason, or sometimes poor health literacy. And now we live in California, where it is multicultural. A lot of people from different parts of the world live here. So sometimes it could be the language barrier to understand, and sometimes how the medication has been listed. Sometimes it could be empty stomach, or sometimes it can be told that it has to be taken twice daily or once a day, how we write the medications. And sometimes it can be because of the disease itself, or what the belief of the disease itself for the patient is. Sometimes most commonly, I have patients who say that they think that if they have a sore throat, they think that if they just take antibiotics for 2 days, they are fine. They just discontinue the medication. But we insist on taking the whole course of medication. Otherwise, they become resistant to it. So,
It is a problem.
yes.
67% to 85% of the American public do not take their glaucoma medications on time or at all. 85% of American patients with high blood pressure do not take their high blood pressure medications on time or at all. And 8% of people save money and don't take medicines. They don't have the money. Their choice of eating a meal or buying their medication. So not only has the Affordable Care Act been good in giving people access to care, however, they don't have any medicine. So you have care, but no money to buy the medicine. So it's a very sad situation. You get care, but even though we know how to treat it, we can't provide you with the treatment. So it's very sad. Now, Laura is a big cat lover, and you know, as we know, cat food and cat medicines. Tell us about cat food and cat medicines and the labeling.
Well, cat food is generally labeled with very big fonts, bright colors on white colors, so you can really clearly see it. But then when it comes to the actual nutrition facts, if you want to make sure your animals are being healthy, it gets really small, very hard to read. And cat medicines, or medicines for pets in general, are contained in the same bottles as we dispense medicines for people. So the same orange bottle, hard to open, and small fonts. So it could even be a problem if somebody were to accidentally take medicines for their pets rather than for themselves.
That's very interesting. You know, I have another thing to tell the home audience. Did you know that your pharmacist could give you this medicine instead of like this, which is very hard to open, put it this way, where it's much easier to open? And here I am, a physician, and this is not commonly told. So, look, this is much easier to open, and this is very hard to open. And this is a relatively simple one. Some have two phalanges, where you have to be somewhat clever with your forefinger and thumb, press down twice, turn it counterclockwise with little arrows on top. By this time, you're already about to take a sledgehammer to break open the bottle, because you can't, because some people are missing the use of this, or if they have stroke, or they've had hand injury, or this part of their hand is weak, it's very hard for them to do this. And it's a very difficult problem for the elderly. In addition, the font size is very small. For example, not that we are all Coke drinkers, and you know, I drink Pepsi also, and I drink everything else, but I think that what they do in terms of labeling, this is very clear. This is one type of Coke, and this is a different type of Coke. So it's very clear for them. So for glaucoma patients, here is a glaucoma medicine. It's very beautifully packaged. And this one is for artificial tears, equally beautifully packaged. Like if you were slightly colorblind or you had a cataract, you really couldn't tell them apart. Do you know what I mean? If you're in a rush. Now let's say you open this. Here is artificial tears. We use all brands, but we just love this coloring. So here, it's a white top, and look, it's shrink wrapped. This is impossible to open if you just turn it. You can't open it. You actually have to turn like this, using your deltoid muscle, your whole arm, your latissimus dorsi. Then you still can't open it. And I'm an ophthalmologist. And here, so then you'd have to take a pair of scissors, and then we'd have to take the scissors. Remember, I'm a surgeon, so I know how to use scissors. I have to go like this, cut it here, and then open this. Still, it's still hard to open. I'm still having a hard time. I can't open it. There is no little thing. There's no magic tear thing. I still can't open it. Now, look, I'm pulling. I cannot open it. It still doesn't come off. This is now taking more than 1 minute. Here, finally, I'm tearing it open. It's open. Now, What if I have to take a glaucoma medicine? Notice, here I open this. The box is easy to open. This is now tamper-proof. Here's another one. And again, it's shrink-wrapped. I try to peel this. I cannot peel this. I have to go like this. I have to find this little tag, peel this. But what if I don't have any fingernails to peel this? What if I have a stroke? What if majority of glaucoma patients are 80s? What if I can't? See, I'm pulling, it's not coming, it's still not coming. This is the 4th time. 6th time, it's now coming. It only partially tore. I still can't get it. So now we have to do this more. Okay, now I have to do scissors. What if I don't have scissors? What if I have to use a knife? That'd be bad, I stab myself. So here we go, we open this. Then, how many people know how to use it like this? You know, so then I peel this open. Aha, it's still not peeled open. So now I have to struggle. Now, this is about 3 minutes. Now I open. Okay, now I open, and then we hold it down, no drop comes. I have to squeeze. I squeeze, it still doesn't come out. I'm squeezing, it's still not coming out. Finally, a puff of air comes out. I squeeze again. Finally, a drop comes out. This is how long it takes to squeeze. And I'm a tennis player. I play 14 hours of tennis. So I have strong hands. And I can't squeeze this. Think of my 80-year-old patient. This is really sad. So then we take, these are branded medications. It's worse with generic medications because their plastic is cheaper. You can't get anything out. So here is a tear. Here, I'm squeezing, nothing, an air bubble comes out, and you think, the air bubble comes out, finally, half a drop. Finally. But notice, the fatness of this drop is different from the glaucoma drop. The reason is the nozzle opening is different for every medication. So no wonder nobody's compliant. Who can have the time to stick it in their eye? By that time, their fingers fell asleep. You know, they have a hand pain. They have to call their granddaughter or grandson to help do it, or their caretaker. What if their caretaker is 60 years old and they can't do it for them? You'd have to, like, cut the whole thing off. No, we're just joking. But I'm just saying, look, they solved it with Diet Coke. I'm sure the industry can do this. This is a problem. Now, this is a real drop. This is, we're not going to mention names, this is so shrink wrapped. Look, shrink wrapped. It's white. You pull this, it comes off. We're very happy. But look at this bottle. Look, you can't, look, I'm trying to open it. It's taking 4 turns. I'm an ophthalmologist, I'm supposed to be used to this. 5 turns, 6 turns, 7 turns. 7 turns, it opens. Okay, now, another cap within a cap. I'm confused because now there's a little lip. I have to pull this lip, tear this around. This lip is very small. What if I don't have any fingernails to do this? What if I'm male? I don't have fingernails. Okay, then I open this. I'm turning. It's not opening. 3rd turn, it opens. Look how small the nozzle is. Small. How long does it take to open this? I turn it. It's not coming out. I'm pressing. I play 14 hours of tennis. Look, it's not coming out. I can't get it to come out. No drop. I'm pressing. Oh, now, they all comes out because I had to do massive. So then this is another problem about compliance. So in one squeeze, I got 5 drops. So the pharmacist is counting how many drops they allow you. So you wasted 5 days. So when you run out early, they won't refill your prescription. So we as physicians, we're kind of tied. Our hands are tied. We write the prescription, the pharmacist counted the drops, and you had wastage. They won't let you have another one. So grandma squeezed it, missed it on her cheek, wasted 5 days supply. They won't refill it, and meanwhile she's missing her medicine. And then that's part of not taking the drops. The frustration of opening this bottle. In fact, my fingers hurt. My fingers currently hurt. This is what we're subjecting our patients to. Number 1, they can't see the label. Number 2, once they see it, they can't open it. And the label is so small. So especially for generics, these are beautifully labeled because these are branded products. The label is so small, they cannot read it. It's very hard. And there's an issue of health literacy. Travatan, Refresh, Temoptic, all the brands, it's small. They don't know. Some people can't tell the difference. It's health literacy, your education level. It doesn't have a little banner that it unfurls. Glaucoma, it's for glaucoma. So that's an issue that I feel that our patients are not being adequately served. There's one more thing. Look at sunblock. Don't you all use sunblock? Okay. What is good about sunblock? Why should we use it?
It protects your skin, right?
Right.
It protects you from possible melanomas and all
Skin
bad things.
cancers.
Yes.
But did you know against UVA and UVB, the magic word for dermatologists is broad spectrum, right? So unless it says broad spectrum, you're not being covered. Now, this is kind of small. Here's Neutrogena, very large. One of the major manufacturers of sunblock. They're a great company. We're not trying to target this company. It just says, when they write this, they at least made it in purple so that people are looking for it. But a dermatologist did a survey in 2017, and she found that the label broad spectrum is very hard to read. She surveyed all her patients. She surveyed dermatologists. Dermatologists know what to read, so they didn't care. But patients, they didn't even know that it was broad spectrum. This is the magic word. Broad spectrum will protect you against UVA and UVB. It should be bigger. It should be broad spectrum. If you go to Australia, where it's the #1 problem, all their sunblocks are approved by the Australian Cancer Council. They're all inexpensive. It's very clearly labeled. So it's very interesting going to Australia and here to see how they label. So it's very important. Labeling is very important about it. Now, what is the problem? I'm sure you've seen it all in patients. What do they tell you? Why don't they take their medicines?
Mostly they say because of how it's written. Sometimes, mostly the elderly patients are on more medications, like 4 or more medications. So at times it's confusing for them. They are old, they can't remember, and at times how the medications has been dispensed. Sometimes some are in the morning, some has to be taken in the afternoon, some has to be taken on empty stomach. So it's sometimes these patients live alone, so it's difficult for them. That's one reason which they say. And the other, sometimes some specific diseases have a certain taboo, so they just don't take the medication. For instance, if they are suffering from anxiety or depression, they just don't take the medication because of the taboo associated with the disease.
There's a lot of taboos in certain cultures about certain things in health. And for example, many in the Buddhist cultures do not believe in heart transplants, and they will never consent to that. And in many cultures, there's one spokesperson for the elderly grandmother or the grandfather, and they prefer the elderly person, patriarch or matriarch, knows nothing about the disease. They're protecting that, and we have to respect that in HIPAA in America. And it's also many people, patients from different cultures will say, yes, I agree, I will do this, but then they won't do it. Because next time they come, their blood pressure is still the same, their blood sugar is still high, they still have diabetes in the eye. And it's very hard for them to tell you, the doctor, that I don't do it, or they don't want to offend the doctor. They want to be very polite, and they want to say, yes, I agree with you, but when they go home, they cannot do it because maybe whoever makes the meals for them will not follow the American Diabetes Association diet, will not follow dietary restrictions because they feel that's punitive for grandma or punitive for the elderly. You know, it's a cultural shift. So there are issues, socioeconomic, like they have no money to buy it, education, they can't read, and there's also number literacy. They can't tell the difference between 100 micrograms from 100 milligrams, like the Synthroid, which comes in micrograms, or levothyroxine. So that's a problem. And or if the pharmacy gives it to them wrong, they're hacked in and they ruin their Epic or whatever control their thing, or their pharmacy tech is not aware of what's going on. They get the wrong thing there. They don't know to read that that's incorrect. So there's a problem. And
Sometimes it's just a lack of communication between the patient and the doctor. They don't effectively communicate because they see a lot of providers and they sit at home and we don't see the patients and we just dispense the medication. So the patients are at risk.
And also, some of the medications are hard for the elderly to swallow, right?
Yeah.
The big pills, and a lot of the generics are very big. They're not like the branded, which are smaller. The generics are big because they have to slightly change the patent or whatever, and they have to use more filler, so it's larger. And you were talking about that.
Exactly. So after working with the elderly, a lot of them have difficulty swallowing, and especially with these larger pills, it's hard for them to take these medications. For me, one of my responsibilities was to administer or offer these medications, and so every time I would see my patient, they wouldn't like to see me because I had a large pill for them to swallow, and especially once they had a gag reflex, they associate that gag reflex, that bad feeling, to taking that medication, and that would prevent them from wanting to take that medication at all.
Right, and also prior authorizations, if you get the same medication made in a liquid, it's no longer paid by your insurance. So to convert it into a liquid, you have to go to a specialty pharmacy, or it takes extra time for the caretaker to chop it up, grind the medication, take it out of the capsule, put it in applesauce, and even then they can tell it's a medication because it tastes bad. The applesauce tastes bad, the pudding tastes bad, and they don't want it. It's very hard, and they need that medication to survive. It is a problem. And I think it's the same thing for pets. To get the medication, right, you have to, massage their throat, trick them, get them into a calm state where they will lap it up in their milk or their liquid. It's very hard to get a pet to take them in. Same thing with children. It's very hard.
I think it's important to remember also the discomfort sometimes that comes with taking the medication. A lot of people that I've met have complained about the pain that comes with putting in eye drops, or the discomfort after taking a pill and feeling maybe a little dizzy or just not all there.
Sometimes the pharmacist, in trying to be well-meaning and educational for the patient, they tell them incorrect things because I think they just give their pharmacy tech a script to read. And what they don't understand is that all our medications for the eye, once it goes in the eye, there's going to be a little bit of a sting because the pH has changed. Because if we were matching the pH of your tears, you would have no medicine because it would be just your tears. And sometimes people have a stinging sensation, even for artificial tears, is because they have dry eye. Dry eye is a $20 billion problem in America. It affects all ages, women more than men, and people spend $1,000 a month for dry eye sometimes, especially their contact lens wearers. I'm sorry, it's $1,000 a year. So what happens is that when they put the eye drop in and they have dry eye, it will sting. But if they don't have dry eye, it won't sting. And for all medications, there's going to be a little bit of a sting, because once the pH is changed in the medicine, it has to, because it's containing a medicine that's not the same pH as yours. So pharmacists sometimes tell the patient, if it stings, don't take it. So that's even worse. That's another reason I'm not taking my medicine. This gives me permission not to take my medicine. The pharmacist told me not to take my medicine. And I don't have to tell my doctor because the pharmacist gave me permission. So they don't take the medicine for 3 months until the next follow-up. They don't call us, or they don't have access to a mobile phone. They live alone. They're elderly. They can't dial. They can't hear. They don't have voice, a phone for if you're hard of hearing. So there are many barriers to care, and it's so important for all of us to communicate that we care, each of us, the family member, all of us in the healthcare provider setting, the nurse, the assistant, the family member, the doctor, everybody, to say it's important to take the medicine, or call us. Don't stay at home quietly for 3 months and not to take it. So to wrap this up for our home audience, in one sentence, what should we tell people about why shouldn't, I'm not taking my medicine. What are you going to say?
Well, I believe that it's really important, and I think part of it, it really highlights the importance of the provider-patient relationship and that trust in that relationship.
I would say that it's very important to also communicate with your doctor. If something makes you uncomfortable about the medication, communicate with them and see if maybe it's a normal reaction, if maybe there are alternatives, such stuff as that.
And call in a timely manner. Don't
Yes.
wait 10 days or until your face is all swollen or you've vomited and you've gone to the ER.
Yeah, my take would be just communicate with the doctor, and then every patient is different, everybody is unique. So we need to look into a lot of factors for each patient and then tailor it to their needs.
Also, it's important to make sure that your neighbor says, oh, that medicine is bad,
Yeah.
not to listen to your neighbor, because maybe your neighbor doesn't need that medicine and is different. So thank you so much for joining us. We want you to take your medicines, and if you don't want to take your medicines, call your doctor and tell him why. And if you think it's the wrong medicine, tell the doctor immediately. And if you have any pain, discomfort, of course, call your doctor's office. And if there's no doctor available immediately, go to the ER, go to urgent care, find out. If there's a reaction, don't wait. Thank you. And again, if you like our show, call up KSAR TV, tell them, make a donation. We're a voluntary organization, we're a nonprofit. We appreciate all the help the community would give us. Thank you very much for joining us.